Hello, everyone. My name is Janicia Harper, and this is Counseling Families. It was chapter 30 by Sydney Moon. So, the purpose of chapter 30 was to give us information over two types of family counseling for families with gifted children, and those are parent guidance and family therapy. So these are some not so fun facts about both parent guidance and family therapy. Neither one of them have been extensively researched, and we'll see this theme throughout this presentation. Much of the literature that we see over family counseling is more clinical theory than empirical research. This literature will typically come from informal clinical reports, case studies, and theoretical speculation. So our first type of counseling, which is parent guidance, comes from a developmental perspective for the gifted children and their parents rather than a therapeutic perspective. We can think of these therapists as educators rather than physicians, since they are more concerned with fostering development as much as they are concerned in diagnosing and correcting mental health problems. What was interesting to me is that this type of counseling is geared more towards the kids rather than the adults because it focuses on the prevention of social emotional problems through early intervention. Most commonly used model in this type of counseling is assessment of individual traits and characteristics, followed by interpretation of test results with recommendations for future actions. There are several fields associated with parent counseling, and those include school counseling, school psychology, and career development. Some problems we see in parent guidance come with school issues, parent concerns, and social emotional development. With school issues, you'll see many parents expecting their child to have special teachers or for their child to be placed in special classes. When this does not happen, parents will feel as though their child's academic needs are not being met. Then, parents will either advocate for better gifted education services or simply feel hopeless. What was interesting to me is that in some situations, schools attempt to provide programs for gifted children, but parents will resist because of family conflicts, discomfort with labeling, or unresolved issues related to their own giftedness. In the parenting concerns portion of this reading, Moon talks about how many parents will feel things such as anxiety, guilt, or pressure since they have the responsibility of caring for their gifted child. In fact, Chinese parents were found to have greater shame when their gifted child underachieves, while the parents of Black children may feel threatened by high achievement because they feel their child's achievement will draw their child away from their family and community. As far as social emotional development, many parents feel their gifted children had unique issues related to peer relationships, emotional adjustment, social adjustment, and stress management. Some clinicians do agree with this notion and believe these characteristics are related to asynchronous development, which is when gifted students will develop unevenly across skill levels. So they may be extremely gifted at reading and writing, but perform poorly or average in their math classes. We're going to discuss three types of parent guidance models, and most of these models will include three components. We'll find an assessment of the child's types and levels of academic abilities, an interpretation of the assessment, and recommendations for parenting and school programming. The first model we'll talk about is Silverman's developmental model. This model is geared more towards parents of young gifted children. The child is seen as a complex, evolving system, and those who use this model help provide a supportive environment for their child's process of self-actualization. The goal of this model is to facilitate optimal development, and we'll see a focus on moral values such as how altruistic the child is and how they contribute to society. This model can also focus on their creativity and achievement. There is a self component of the model, and it's divided into two parts: the child and the parent. This model will deal separately with the giftedness and development of the child, as well as the parent's own giftedness and development. Silverman's developmental model is most appropriate for implementation by psychologists in private practice, since it is comprehensive and individualized. The counseling center in Hamburg isn't necessarily a conceptual model, but they are a model establishment for providing parent guidance. This center focuses on the parents of gifted children who are underachieving and or having behavior problems. There are 5 key tasks that this center provides that you all can read through, but basically they will begin by giving the child and parent diagnostic information, help the teacher plan differentiated accommodations, and provide information to pediatricians and child guidance centers. So here is an identification flowchart that this counseling center uses. So we see things such as, is the child potentially gifted? If no, go to strategy 2. Or if yes, are the parents prepared to accept the child's special needs? And that is for parent guidance. So as we remember, in the other type of family counseling, there's another chart. But there is the Ball State School of Psychology Clinic, and it is developed to provide comprehensive assessments of gifted children and assist parents in advocating for appropriate school services. So this is individual test-based, and it's based on the age of the students and the referral issues and parent concerns. You'll see 5 to 20 tests with a mean of 10 completed. The most common number of tests given is 8. And we see students are assessed for intelligence, achievement, learning styles, personality, and behavior. There's a lot of feedback that comes with the Ball State School of Psychology Clinic. And moving on, so that was all for parent guidance. As far as family therapy, we see that it is interested in the way the children affect parents and the way parents influence their children. This type of therapy sees family problems as situated in the interactions among members of the family rather than particular family members. So it's grounded in the systems theory. All right. Some strengths of family therapy are the fact that family therapists help families create positive climates and are recommended when environments are dysfunctional. For example, when there is sibling dysfunction due to one sibling being gifted and one is not, family therapy can help after assessing how the siblings interact. Also, family therapy can help families who are experiencing life cycle transitions, since the transition from being a young child to an adolescent can be difficult for the families with a gifted child. Now, some weaknesses of family therapy are lack of training for family therapists when it comes to cognitive assessment or school issues. Also, a theme we have seen in our classes this summer is in family therapy as well. It's where you will see high functioning families do not receive as much attention because they are perceived as being just fine. Family therapy is also beneficial for gifted child underachievement. The reading lists the individual, school, and family factors associated with underachievement, and I won't read all of them. But most, if not all of these, should come as no surprise to us because we have been learning about the various factors that can contribute to underachievement this whole summer. And those are the family factors. All right, so family therapy is also beneficial for twice exceptional children, since families often feel helpless and frustrated. But the theme, again, we've been seeing in this presentation is that little work has been done to develop specific therapeutic approaches for families of twice exceptional children. Family therapy has models as well. Once again, Moon highlights how there has been little research over these models, and family therapy models have 3 categories. We have systematic approaches, postmodern approaches, and integrated approaches. For the systematic approach, we have the Bell and Blank Center for Family Counseling and Assessment program. This program is strength-based and focuses on helping families identify their own strengths so they can solve their own problems. What was interesting to me was that this program is very brief with a maximum of 5 to 6 sessions. This program is effective in developing family counseling treatment plans. So a structural strategic approach views the family as a system where social emotional problems reside in the family system rather than in individual family members. And therapists will focus on assessing and changing family interaction patterns. So my favorite of all the interventions is this one, which is the imaginative postmodern approach. This is where a therapist will use fairy tales and creative narratives as therapy strategies. The reading talks about a boy who was underachieving and had this therapy, and the therapist developed a way for the boy to let his emotions out by using a Dr. Seuss figure to help him externalize his problem instead of keeping his feelings to himself. This is just one example of an imaginative postmodern approach. Our last approach is an integrated approach where therapists are trained in both family therapy and giftedness. This approach combines family therapy, parent guidance, and talent development psychology. So if we look at the picture in the slide, there is an overview of the 3 phases of treatment. So we have an assessment, treatment, and the follow-up. And the session depends on what type of approach will be used. So the letter F is for family therapy, C is couples therapy, and I is individual therapy. This also draws out which type of theoretical framework will be used each session and the intervention topic. So they kind of mix up the different approaches for every session, and this is very beneficial. So our discussion questions are as follows. Imagine you are the parent who seeks counseling because of at least one of the presenting problems mentioned earlier. Which type of parent guidance do you think you and your child would benefit most? So remember, there's a difference in the parent guidance models and the family therapy models. So I would go back and look at the presenting problems and kind of see which type of parent guidance you think would, help you and your child the most. And number 2, imagine you and your family are struggling with the life transitions associated with having a gifted child. Which type of family therapy do you think would be most beneficial for you and your family? So again, I will go back and look through the family therapy part and see which one of those approaches would best fit you and why. Thank you all so much. Have a great day.